More breaking information this afternoon. One of the two nurses who contracted Ebola while treating a man in Dallas is now Ebola-free. Doctors just giving Nina Pham the all clear, confirming she no longer has the virus. She is expected to be released from the hospital today. Pham became sick after treating Thomas Duncan, the first Ebola victim here in the U.S. And it's still touch and go for the first person diagnosed with Ebola in New York State. Dr. Craig Spencer is in an isolation unit at Bellevue Hospital in New York City, a designated Ebola treatment center. Doctors confirmed he has the virus on Thursday after he reported a 100.3-degree fever and gastrointestinal problems. Now, Spencer was treating Ebola patients in Guinea while working with Doctors Without Borders earlier this month. That's where he likely contracted the virus. Right now, doctors are reaching out to any person who he may have had contact with. And the next question about this developing story is, how prepared are we in New York State and Western New York as Ebola hits closer to home? 7 Eyewitness News reporter Rachel Alzafon joins us with more.
Well, Laura, local healthcare leaders and top state politicians say this is the last thing they wanted to see, but they are very adamant New York is prepared. What we saw in Dallas will not happen in this state. Hospitals across Western New York State, and the country on higher alert, preparing for the worst.
We're just trying to get our ducks in a row, do Monday morning quarterbacking, see the mistakes that were made, and see what changes that we can make.
The latest patient, Dr. Craig Spencer, worked in West Africa with Doctors Without Borders. Erie County Health Commissioner Gail Burstein says there are Western New Yorkers helping Ebola patients too.
They're going over to West Africa to volunteer their services, and they're going to be returning back home.
These workers will be examined, monitored for symptoms, and stay in close contact with the local health departments and CDC. Even though none of New York's designated Ebola treatment centers are in the Buffalo area, Burstein says we are prepared to take patients in.
Participate in the diagnosis and the initial management of patients who potentially or do have confirmed cases of Ebola virus. So all the hospitals are prepared, at least for the short term, until a patient could be transferred out.
And as for the disease spreading to Spencer's doctors, like what happened in Dallas, healthcare experts and Governor Cuomo say that's unlikely, that New York has a strong plan in place.
We were hoping that it didn't happen, but we were also realistic. This is New York. People come through New York.